Broadcast is now starting. All attendees are in listen-only mode.
Hi, welcome everyone who has already joined. Looks like we have quite a few people here. If this is your first time using GoToWebinar, I'll tell you a little bit about it. I know maybe we're all a little used to using Zoom right now, but GoToWebinar is quite helpful just for showing slides. I'm just going to be walking through slides today, and you'll hear my voice. And this is a live webinar, so I encourage you to ask questions. So you can ask questions using kind of the question box, and I'd be happy to answer those. I'll try to keep an eye on that to make sure I can answer those at the time, but also I'll stay after the webinar and answer questions after that also. One more note is that we will make a recording of today's webinar, and we'll make that recording and the slides available on the gateway. So if you have colleagues that you would like who weren't able to attend and you would like to send them this information, they'll still be able to have that, or you could have the slides to review for yourself later on. So let's get started then. So welcome to this webinar. I'm Tristan Phillips. I work at the Center for Economic and Social Research at the University of Southern California. And specifically, I work on a project called the Gateway to Global Aging Data. And this webinar is going to be an introduction to the Gateway to Global Aging Data and to harmonized data sets that we've built as part of that. So by the end of this webinar, I hope that you kind of have a sense more about the international family of health and retirement studies that collect a lot of this global aging data, some of the resources that the Gateway provides for you to do research with that, and just some more information about how to get started using harmonized data sets. So the Gateway to Global Aging Data is a platform for population survey data on aging around the world. It's a free public resource. We're funded through the National Institute of Aging, which is one of the National Institutes of Health here in the United States. And it's designed to facilitate cross-national and longitudinal research on aging using the International Family of Health and Retirement Studies. So as I walk through today, I think you're going to get to know a lot more about health and retirement studies that are around the world. This is a network of studies that are conducted in a similar way in lots of countries around the world. So you can see here's a list of 45 of the current countries that have data fielded and available from these surveys. So it covers more than half of the world's elderly population. It's quite a powerful resource to be able to compare between countries. There's a couple hallmarks to all of the studies which are considered part of this network or this international family. And so those include that they're population representative of older adults. These are longitudinal surveys, so they interview someone one time and then they come back at some point later and they re-interview them again. They're multidisciplinarian, so these are not just economic surveys or health surveys. They cover a lot of the topics that research has shown to be related to the process of aging and retirement decisions and end of life. This network of surveys also has coordinated survey instruments. So a lot of care is taken to make sure that perhaps the question that is asked in the Irish study is the same as the question that's asked in all the other studies. They're really designed to be comparable. They have enhanced economic data. So there's really high level income, wealth, and consumption for some studies data that can provide a lot of information about our resources available to individuals and to households. They have integrated biomarkers, so it's not just all survey data. They actually have a physical collection of biomarkers, and there's some physical tests also. We'll talk more about those things. And all of these data sets have publicly available data. So this data is available for any researcher in the world for the purpose of research to download and to utilize. You can see here on the right, of course, this isn't all 45 countries, but you can see some of the interview periods that different countries started with. So you can see the US actually started their first survey, the Health and Retirement Survey, or Health and Retirement Study, excuse me, in 1992. And the HRS, Health and Retirement Study, has followed up basically every 2 years since then. The next country to start a similar study of this network was Mexico. And you can see they had wave 1 and wave 2. Then they took kind of a 10-year gap and they came back with wave 3. They now have wave 4 data that's also available. And so you can see that over time, more and more countries have joined this network. As I mentioned, this set of studies is multidisciplinary. So here, I'm just going to briefly mention some of the core content areas which are covered in these data sets. So these include demographic questions, things about education, where you were born, your marital status, questions about health, questions about healthcare services that both includes kind of healthcare utilization, spending on healthcare, and insurance. Work and employment, of course, it's health and retirement. So there's a lot of questions in here about people's transition out of the workforce into retirement. A lot of economic questions, as I mentioned, it's really high level quality economic data. And there's other questions about family structure and social network. And this is really just a kind of a broad group of them. There's lots of other particular content areas which are also covered by these studies. So because there is so many studies from so many different countries, and it covers a lot of different topics, and then even inside of one country, there's I think been 14 waves of the HRS here in the United States. So it's a lot of data to sort through, and it's hard to do longitudinal analysis and even harder to do cross-study analysis with this data set. So for this purpose, we designed the Gateway to Global Aging data. So it's available at g2aging.org. I'll briefly switch over to it, and I'll do this a couple times today as I demonstrate some things on the site. So I think as we kind of go through the Gateway and the features to the Gateway, you're going to start to know a lot more also about the entire, the family of global health and retirement studies. So what's available on the Gateway? And we'll walk through all of these in more detail, but the Gateway includes an overview of all of the HRS family studies. So we've built a study overview to give you information about each study. We've got survey questionnaires for each survey that is part of each study. We've built flowcharts which illustrate survey skip patterns. And we also built kind of an intelligent keyword and topic search. If you're interested in doing cross-study comparisons, we've built cross-study concordance tables for specific survey topics. And we've written some in-depth documentation of cross-study comparability for also certain topics. We also have survey statistics that are shown in interactive graphs and tables, and this is quite a nice way for kind of a new user or researcher to kind of get access and to play around with these data before having downloaded the data themselves and kind of generating things on their own. I'll show some examples of that also. One of the things that we've added in the last year is the ability to also compare contextual data. It's part of a new initiative that we have at the Gateway to really bring in information, important like kind of contextual, institutional, and environmental information. So we allow you to kind of compare what we're seeing happening in the data with kind of the maybe macro level things that we're seeing happening for that country. We've built a catalog of publications that have been published based on HRS family surveys. And then lastly, I mentioned harmonized data. And harmonized data, I'll briefly talk about that now because I'll keep referring to it. So I want to be clear what we mean by that. So harmonized data sets are really user-friendly versions of the study data themselves. And I'll talk more about like kind of some of the hallmarks of what makes a harmonized data set. But it's one of those features that is most helpful for new researchers because these data sets are really built to be able to compare cross wave, so across time in one study or between different studies. And they're quite user friendly. We call them research ready. Um, so as I mentioned, we'll walk through those steps. So this is our study overview. This is a new thing that we've recently built. And currently we just have it for ELSA. We'll be building out in the next couple of weeks a study overview for other studies also. But it's a really helpful place to get started to learn about a particular study you might be using. So here we're looking at ELSA. That's the English Longitudinal Study of Aging. So it's looking at England. And so there's a lot of good information that's important to know if you're interested in using data from this study. So we have information about the sampling frame. For instance, ELSA, their age eligibility for the sample is anyone who is age 50 or older. ELSA interviews one person per household and their spouse, regardless of their spouse's age. So you actually have some people in ELSA data who are quite young, who are in their 20s or 30s even, because their partner is age eligible. ELSA is a nationally representative sample. And while they didn't originally sample into institutions, so something like a nursing home, they do follow their respondents into a nursing home. So you can see information about people's living situation when they live in a nursing home. And there's no oversampling done as part of the ELSA sample. Some studies, like the HRS, for instance, in the United States, includes an oversample of Black and Hispanic Americans. The LASI, which is the Indian version of the HRS, includes an oversample of people aged 65 and older. So these oversamples can be used to really give power to researchers who were looking to, consider important subpopulations. So you can see here under data collection, we've got the core interview collection periods. So for ELSA, wave one began just a little bit after 2000, inside of 2002, and there's currently 8 waves of data available. And ELSA has a very regular cycle of giving this core interview. In addition to the core interview, and that core interview tends to focus on the same questions over and over, so that you can see kind of individual trajectories as someone moves through their life. There's also other types of data which are collected. And here are the other types of data which ELSA collects. So they collect end-of-life data. So that's an interview that happens with kind of a next of kin or a caretaker after the person has passed away. So you have a lot of really important information about the time leading up until their death. We have life history interviews, which are conducted by ELSA and some other studies. And life history interviews go through a person's entire life before they entered the study. So for most of these studies, they focus on people age, I would say like 45 or 50 and older. So there's a lot that's happened in their life that you might not know about. And this life history interview goes through someone's whole life, through their parents and their childhood to their adolescence and early adulthood, to kind of provide more clarity about what happened to this person before they entered, in this case, the ELSA survey. ELSA includes some self-completion surveys. So this is a survey that, instead of being done kind of through an interview, they leave this information, they leave this questionnaire with the respondent, and they fill it out on their own. It's often used for questions which someone might feel self-conscious about answering to an interviewer. ELSA at wave 6 and 8 did a sexual activity and relationship self-completion survey, which was really fascinating. And I think that's like a good example of why you might want to allow someone a self-completion survey. We also have a health assessment as part of ELSA. As I mentioned, there's integrated biomarkers. So that's conducted at every other wave, basically via a nurse assessment. That nurse assessment also included drawing venous blood. ELSA also has an HCAP survey, which is a harmonized cognitive assessment protocol. And this is a really in-depth cognitive set of tests that are done across different studies. And ELSA has also provided genetic data from that blood that was drawn. So they've conducted a GWAS, and that's available for people to download and use if you're interested in using genetic data. We have some information about the sample and the response rates kind of by wave. Lots of samples, lots of studies kind of resample. They have what we call a refreshment sample. Because of course, if you start interviewing people at age 50, 4 waves later, you're not going to have a lot of people aged 50 anymore in your sample. So these refreshment samples can be helpful to make sure that you still have information about people in their 50s or at younger ages. Lots of studies, ELSA in particular, have data linkages. So they ask for the respondents' consent to link their data to some administrative level or national level data sets. So ELSA here provides linkages about mortality, healthcare utilization, cancer, pensions, and national level benefits. We have links to access all the different kinds of data which are available as part of each study. In general, the gateway does not provide data, with a few exceptions. We are really kind of a central resource for researchers to get information about what's in the surveys themselves, how to use them, and we generate these harmonized data sets. But to download the data itself, you're usually going to go to the study's website. And then we've also built harmonized data sets, as I mentioned before. So we have 2 built for ELSA. We'll have more coming in the future. Once you have some background about the study, you can then look at the surveys which are part of that study. So as I mentioned, there's different kinds of surveys. Here we're looking at the core interview survey. And you can see that surveys are usually referred to as waves. So the baseline survey, that first survey, is called wave 1, and then wave 2 is the first follow-up survey, and so on and so on. So you can look down into each one of these kind of individual surveys to see what was asked at that wave in that year. And as part of the gateway, we have information about the order of the modules inside of the survey and the order of those questions within the modules. One of the important things that's helpful to think about when you're using survey data is to understand survey skip pattern. So not every question is asked to every person. For instance, many surveys will ask financial questions about the household, but they don't ask that to every person in the household. They usually pick one person, a financial or household respondent, and that person will answer on behalf of that. So understanding the survey skip pattern is really helpful. Here's a simple example. This is from SHARE, which is the Survey of Health, Aging, and Retirement in Europe in 2006. This is their second wave. And at the beginning of their behavioral risk module, they asked the question, have you ever smoked cigarettes, cigars, cigarillos, or a pipe for a period of at least 1 year? And if you answer yes, then next you get asked, do you smoke at the present time? So you can see here what this survey skip pattern is doing. There's no need to ask people, do you smoke at the present time, if we know that they've never smoked. So it saves the respondent and the interviewer some amount of time. But if you're interested in kind of smoking prevalence rates, you need to think about what questions that person wasn't asked based on the survey skip pattern. So this can kind of be helpful to think through if you may be using the data yourself and you're seeing a bunch of missings, to understand where those missings are coming from, and are there ways that you might want to account for them. And then we also have item level detail for each survey item or question. So you can see here we're looking at that whether you smoke at the present time question for SHARE. One thing you'll notice is that everything in this site so far is in English. Most of these surveys, of course, are not conducted in English. SHARE is conducted in more than a dozen languages because it covers a lot of different countries. And of course, in certain countries, there are a lot of languages just inside of one country that are used. But you can see a lot of item level detail about this survey question. So you can see that the question text is, do you smoke at the present time? The respondent could answer yes or no. We also let you know that a yes in the SHARE data is coded as a 1, and a no is coded as a 5 for this question. And that can be really helpful and important when you're looking at the data set itself. Of course, you can kind of browse through all the survey data, but as I mentioned, there's a lot of survey questions and it's a lot to go through. So we've also built a search, um, a keyword search and a topic search. So this keyword search here in this example that you're seeing, we search for the word smoked. And you can select by which study you want to, certain studies or certain years. And here we've just kind of done all of them. And you can also filter your results. So here we're looking at ELSA, that English data set that we saw a study overview for. And in their 2002 wave and in their health module, they have a question here, whether you ever smoked cigarettes, and then the responses. Below that, you can see we get a question, do you, whether currently smoke cigarettes? And you might notice that even though we searched for smoking, we're getting results for words like smoke and smokes. That's because the search engine has some intelligence to kind of guess what other words you might be looking for, not just the one word you searched for. For the topic search, it works slightly differently than the keyword search. And for that, let's switch back to the gateway itself. So we'll click at surveys at a glance, and that's where you can both get access to that search, that study overview we saw, for instance, by clicking on ELSA here, and find information about the other studies. But let's look at a subtopic search. So for a subtopic search, you can see for a lot of different subtopics, we could just pick one. Let's pick number of children, for instance. The subtopic search is only going to search over harmonized data sets. So it's not going to search through the study questionnaire themselves. We haven't mapped all of those. And we could just say, yeah, all harmonized data. And what we're going to get are the actual answers inside of the harmonized data sets. You can see we have this variable as part of the RAND HRS. It's also part of the MHAS. This is the Mexican survey. And it occurs at different years. Of course, we could say, let's just look at it in 2012. What are those variables that relate to it? And we can find those variables there. And this is a really helpful way to be able to kind of find your survey variables as part of the harmonized data sets and to figure out what's comparable and what's available. Again, to that topic of kind of knowing what's comparable and available between different studies, we've built concordance tables. So for about 12 different topics currently, we've built tables that kind of try to capture cross-study variability. You can see in this example here inside of the family and social network section, we've got a family demographic comparison table that goes through a lot of these studies and says whether this data was collected and or available. So you can see that all of the questions, all the studies ask household size. And all of them ask the number of living children. There is some cross-study variability, though, in the number of children who have died. So it looks like ELSA didn't ask about the number of children who had died. Neither did JSTAR, which is the Japanese data set, Corellis, the Costa Rican data set. And then there's even more variability with the number of children ever born. So not deceased or living, but just ever born. Only looks like 3 studies here, the HRS, the MHAS, and Corellis asked that question. So these can be helpful if you're just getting started on your research and you want to make sure to know what's comparable between studies before maybe going through the trouble of applying for and downloading a data set and understanding that study in particular. We've also built some documentation. So that's the working paper series on cross-country comparability. So for certain kind of research domains or topics, we've built with researchers from that field kind of an in-depth paper. So these are papers, which is why I don't kind of show it here, because there's a lot of detail about what are all the questions, for instance, with stress. What are all the questions that are asked that kind of capture stress in all of the surveys? How are they different? How are they similar? What are strategies that have been used to compare between studies and to maybe address any study differences? So that can be really helpful. Also on our documentation page, we have recent presentations. This is where we'll list, shortly after today's webinar, we'll list this webinar there. You could download the slides or the video. But I'll also mention that you can watch other videos. So this is an introductory webinar video. We have some advanced webinars that go through kind of more programming examples. We talk a lot about weighting the data and things like that. And then we have some that are about specific topics. Here we have some information on dementia care also, or using life history data, using HCAP data, which is the Lassie Diagnostic Assessment of Dementia. And as I mentioned, we've built graphs and tables, and these are interactive. These can be quite fun to play around with. You can select from over like 100 topics and 30 countries and 12 different years. And the graphs and tables is actually going to it's pre-generated in the backend survey estimates for these topics. So one of the nice things about these population estimates is that the weights are already applied. You don't have to worry about that here. And it's a nice way to get started. I'll jump back to the gateway and we can actually look at this page itself. So this is the graphs and tables page. And once you get here, you can see some kind of interesting examples of comparisons between different countries. You can also map certain things, and we allow you to compare by subpopulation differences, or you can see a table. All of these images and tables can be downloaded directly, and you can change any of them. So here's a graph of ever had diabetes by country. We haven't limited it to any subpopulations. We've limited to age 65 subpopulation. We could say, what about for people age 75? Let's change that. And what we're going to get is a different graph for people age 75 and older. And you can also toggle sort, so it's going to show you that we would predict that, for instance, Israel looks like it has the highest, though not statistically different from Czech Republic and Spain, level of diabetes for people age 75 and older. It looks like China, again, has the lowest, but not statistically different from some of the other countries on the low end for age 75 and older. And you can see this information also in table format. The tables have some other helpful information like the standard errors and the N used to calculate it. Or you can see that that information graphed also on a map. Here's an example looking at any financial transfers in 2012. One of the things that you can really see is there's a lot of cross-country variation in whether households are receiving financial transfers from their children. In particular, Mexico, China, and Korea households much more regularly. More than half of households in China and Korea receive financial transfers from their children. These would be households who are with respondents who are over the age of 50 or 45 actually, for 45 for China and 50 for Korea, where you see it's really small, especially in the European countries, this level of financial transfer from children. And as I mentioned, we've built in contextual data which you can compare. So here on the left, you can see this is plotted for the United States between 1996 and 2014, and we plotted individual level earnings. And we've done this just for people aged 50 to 59. So these are people we expect to be kind of working age. You wouldn't normally expect someone to already be in retirement by age 59. And we've done 3 different subpopulations. So the blue line here represents people with a college education. The green line represents people with a high school or vocational education. And that last kind of reddish line is people with less than a high school education. And we've contrasted that here with US GDP per capita for the same time frame. So we can see that overall for the United States that GDP per capita has really increased. It's really kind of a striking increase between, in this case, 1996 and 2015. But when you put this side by side with the individual earnings, what you really see is that kind of the returns from this GDP per capita are really only being experienced on an individual level earnings level by people with a college education. It's fairly flat. There's a small increase for people with a high school or vocational education, and it's really flat for people with less than a high school education. So again, these kind of interactive graphs and tables are just ways for you to get started to know kind of, what's the capacity of these data sets, and can I play around with the data before kind of digging into the data set itself and generating your own estimates. We also built a publication search. Again, one of the things that we try to do is kind of be kind of a one-stop shop to get started on using this global aging data. And part of doing any research is understanding what research has already been done. So we've built this catalog of publications, and these are all publications that inside of their publication were based on data from one of these studies. And one of the things that we've done is we've actually gone through each of these publications and tagged what study they used. And often this information is not in the title or the abstract of a paper, so it does take some amount of work. And that's a small advantage that we have over something like Google Scholar or PubMed, is that as you can actually say, what are all the studies that, for instance, use the Mexican data of MHAS and looked at cognition. And even though MHAS might not be in the title or the abstract for the paper, we've gone through and tagged that. I will say we update this fairly regularly. I would say maybe every 6 months we try to update all of the studies, research papers, but we are not going to have kind of the latest within the last 6 months papers, which you might be able to also find on Google Scholar or PubMed. But it's just one more resource. And any of the publications you find here, we include links to be able to read those publications. Or if you can't read them, links to where you might be able to access them. And you can export in a couple different export formats as a bibliography, a set of papers. So we're going to spend the rest of the webinar talking about harmonized data. And as I mentioned, that's kind of the thing that researchers use the most as part of the Gateway project. So harmonized data sets are created to provide comparable research-ready variables. So variables are defined as similar as possible across all waves and all studies. Each harmonized data set combines all waves of a study, and each individual is one record. So there is one kind of core harmonized data set for each study. So one for ELSA, one for MHAS, one for SHARE, one for TILDA, the Irish data. And these are FAT files where each individual was one record. And how we make this FAT file is we use an intuitive variable naming convention, which was actually developed by the RAND Corporation, who built the RAND HRS. So for instance, a variable like R1 BMI is the respondent's BMI measured at wave 1. And then because this is a FAT file, we would have a variable like R2 BMI, which would be the respondent's BMI as measured at wave 2. We also use study-specific variable names to indicate significant inter-study differences. So for example, as part of the Harmonized Charles, which is the Chinese dataset, we have a variable built called R1 LBRF, or labor force underscore C. So that underscore C tells you that there's something specific to Charles about this variable. So although we've got a labor force variable called R wave number LBRF in the other harmonized datasets, Charles used a different response scale. And this makes complete sense. Particularly like work arrangements and the labor force arrangements are going to be different in different countries. So Charles used this scale, which isn't exactly comparable, but it's important information. And we really try to be transparent even in the variable name that this isn't exactly comparable, but it captures the same information. We've also built spouse versions of most variables. So even though the spouses also interviewed themselves, we would have a variable called S2 work, which is whether the respondent spouse is currently working at wave 2. This can be quite helpful. Just take some programming legwork out if you want to look at spousal or family effects. And then variables have been built to account for survey skip pattern. And this is kind of what we mean when we say research ready. So there's things that we've done to these variables to make sure that you don't have to know everything about how the study was designed to be able to use them, although we do provide you all that information. Here we design a harmonized variable called smoke ev, so that's whether the respondent has ever smoked. The harmonized variable, they all use the same value codes, so a no is going to always be coded for all variables across all harmonized data sets as a 0. A yes is always going to be coded as a 1. And we can see here some of the differences by study. So Share at Wave 1, so that European data set, just ask the question to everyone, have you ever smoked daily, yes or no? We saw that question, right? That's on the left side. On the right side, we have LZ, which is the Brazilian data set. So they ask, do you currently smoke? The respondent could say yes daily, yes less than daily, or no. And if the respondent said no, then they get asked, have you smoked in the past? And you can say yes daily, yes less than daily, or no, never smoked. So you can see that we have to account for this survey skip pattern difference between the two studies if we want to make a comparable version of whether a respondent ever smoked. So that's something that's already been done if you just use this harmonized variable in both data sets of smoke of. That's a really simple example of harmonization. They also get much more complicated. So this is JSTAR, the Japanese data set. And this is just making one variable, which is the level of savings per household. And there's a lot of different questions that you have to account for. There's also unfolding brackets that you want to account for if the person didn't know the amount, so that you can provide an imputed amount. That's kind of what we mean when we say enhanced economic data. So there's a lot of work involved in making these often. One of the things we thought about when we were first designing and thinking about the gateway to global aging data was that there were a lot of researchers who were using these data sets who were doing exactly the same thing. So a lot of researchers, regardless of the type of researchers, perhaps want to be able to control for household level wealth or respondent level income, individual level income for a person, regardless of different research domains that they focus on. And so a lot of people were programming, for instance, total household wealth over and over, and in sometimes different ways. So one of the advantages of using a harmonized data set is we've built some of these variables like total household wealth, like total household income level, in ways through kind of approved ways. We've consulted researchers on each of these in an approved and kind of consistent way with lots of documentation, so that you can know exactly what went into that. But it's also saving the research community quite a bit of time to not have everyone going through and programming the same thing over and over. And that documentation comes in the form of harmonized codebook. So each harmonized data set is accompanied by its own codebook. You can see here examples from the harmonized ELSA, that English study. And the codebook introduces the harmonization project and the study itself, in this case ELSA. We talk about a lot of those things that you saw on the study overview tab, including survey timing, survey design, sampling framework, things specific to the data set. So we discuss weighting and imputations. So if the study provided weights, what are they based on? How might you use them? And the same thing with imputed data. So if the study provided information or gave values to people who had missing values, how did they decide what to put in that value, and how might you know whether they had it? We talk about the harmonization process, and then we've got all our harmonized variables divided into sections based on research domains. So you can see here for the harmonized ELSA, section A is focusing on demographics, identifiers, and weights, and the last section on this page, section M, is focusing on stress variables. For each set of sections, we summarize the set of variables. So you can see here, we're back here to our smoking variables. We've built smoke EV for the respondent and smoke EV for the spouse. You can see again, of course, we've got 0 and 1 for no and yes. And we also use special missing codes, and these special missing codes are available in STATA, SAS, and SPSS. And they help to give you a little bit more information about why something might be missing. So something could be missing because the person said, I don't know. The person said, I've refused. Some questions aren't asked if the interviewer was a proxy for the respondent. So maybe the respondent had to leave the room, or they had to take a nap, or they weren't feeling well. They could be having some cognition or dementia issues. And so sometimes someone else, maybe a spouse or a caregiver, might answer questions on their behalf. But not all questions are asked to a proxy. So we would let you know, oh, this person wasn't asked this question because a proxy actually answered for that person. We detail the variable creation and any assumptions made in the creation. So we just have a lot of kind of plain, understandable text about how that was made. We highlight any differences between the waves and any differences between this variable and the HRS version of the harmonized variable. So you can see in this section for ELSA, we do highlight some differences that happened between waves with these questions about smoking in ELSA. For instance, based on your answer at your first interview, if you said that you smoked during your first interview, the questions that you get asked at your second interview are going to be a little different because we already know that you have smoked before. And then we highlight differences with kind of our baseline comparison of the HRS. And in this case, there's no significant differences between this variable and the version in the RAND or harmonized HRS that you need to worry about. The last thing that we do is we list all the variables from the originating data set used in the creation of the variable. So everything that we used from the study data, we tell you what we used. We try to be really transparent about everything that we do. This is part of it. Also, as part of that, we release all our programming as in Stata code for any researcher to be able to review or revise or just see what we did if you want to look at the programming yourself. We try to be really transparent about everything that we've done. So here's a list of our the core harmonized data sets that are currently available. So for HRS, there's a RAND HRS and a harmonized HRS. I'll speak briefly about why there's two. So the RAND HRS is actually a much older project than the Gateway, and that's a user-friendly version of the HRS data that was created and is still maintained by the RAND Corporation. And it's a really popular way for people to use the HRS data because it's so user-friendly and has so much great documentation. We've also created what we call the harmonized HRS, and that's really a supplement to the RAND HRS. So we don't duplicate anything that's already been done, but we kind of look outside of just the HRS and say, what are some comparable measures that we want to make across all these different studies that might not have already been in the RAND HRS? And we create those as part of the harmonized HRS. We have harmonized data. I'll just tell you which countries here they are for Mexico, for England, for SHARE, which includes 30 European countries, and Israel, I think more than 30 now, Corellas, which is Costa Rica, Korea, Japan, Ireland, and China. And in addition to core interview life history data, we've also built some additional types of harmonized data set. So that includes end-of-life data. So if you remember, I mentioned that end-of-life survey that happened. So this is a data set that has information just from that survey. We've currently built that for the HRS and SHARE, and we're in the process of building that for ELSA, MHAS, and CLOSA. We also have harmonized life history data sets. So these are really interesting. These are aged sequenced data sets. So it would go through, for a person in ELSA, for instance, we built this for ELSA and SHARE, a person at every age of their life until they enter the survey, and we're able to tell you things about whether they were married or not, whether they had children or not, whether they were employed or not, whether they were in education or not, where they lived or not. And it'd be really helpful, especially if you want to look at different people's trajectories through their life. It's really a life course approach to looking at aging. We're also going to be building, in addition to ELSA and SHARE, we're going to be building life history data for the HRS and Charles in the next couple of years. And then we also have harmonized HCAP data, and that's that harmonized cognitive assessment protocol. So that's that set of tests that are done in a lot of different studies. Currently, a lot of different countries, excuse me. Currently, we've built a harmonized version of the HCAP for Lassie, which is the Indian data set. That's an early release, so it's not quite the full data set. We'll have be updating that with the full HCAP study later on. And we'll also be building this for HRS, for MHAS, for ELSA, and for the Chilean HRS, which is called EPS. So let's talk about how you obtain harmonized data sets. So harmonized data files are either distributed through the gateway or by the originating study. Uh, this is our download page here that you can see on our right. So the first thing that I'll mention here is you can also get a link to download the original survey data. So as I said, the gateway doesn't usually provide survey data. You would have to go to each study and register for that for yourself. Also at the top of this page, you can see a note about registering for access to any of the HRS family studies. We've kind of, a lot of the study registration is exactly the same by study. So we've built kind of a universal study agreement page that you can fill out and get registered for a lot of the studies at one time. And then below that first row, we have links to download the harmonized data sets, download the harmonized codebooks, or create the harmonized data. Create the harmonized data gives you that stata code that we used. And you can see in the case of particularly share and CLOSA that you need to refer to that stata code to create the harmonized data sets. So in the case of share and CLOSA, you do have to have access to a version of stata to be able to run this harmonized creation code once. So what happens in this processes is you're going to have downloaded all the share data, and we give you information about what to download and how to store it. And then you're going to run this data code once, and that's going to give you, for instance, the harmonized share. And once you have the harmonized share finished from stata, you can kind of convert that to R or SPSS or SAS or any other format you'd like to use. If you don't have to create the data set yourself, most of the data sets are distributed in stata, SAS, and SPSS format. And you could let us know if there's a format that you would like access to which you're not able to get, and we can try to work with you on that. To be able to download a lot of the things that we talked about today, including the concordance tables, to download the data creation code or the harmonized code books, we do ask that you register. Registering is really simple on the gateway. You just kind of give us some basic information and confirm your email. It helps us keep track of who's using the website and what you're doing with it. And part of the reason for that is, of course, we're a publicly funded project. So this is also our requested citation, and we're funded by the National Institutes of Aging. So if you have a publication that you use that uses maybe data from the harmonized data sets or information that you found on the gateway, we do ask that you include this citation. And this helps us continue to be funded to provide other researchers more helpful information. We're always trying to expand what we're doing here at the Gateway. We're adding more studies. Of course, for all of these studies, as they add new waves of surveys, we add that data back into our harmonized data sets and add on to the Gateway. We've got a lot of initiatives. You saw some of them there, like with HCAP and with life history and with end of life, that we've been with contextual data, where we've been trying to expand what we are able to offer researchers based on what researchers have told us they're interested in using. So please do include register, and then please include our citations in your papers. We have, lastly, I'll just mention we have a help desk. So it's help@g2aging.org. There's a whole team of people who work on the Gateway, programmers and different kinds of researchers and research assistants who have really built this over the last 12 or 13 years now. And so if you have a question about using the Gateway or getting access to these data sets or starting your analysis using harmonized data, you can feel free to email us here. It goes to kind of the whole team of people who work on this, and we try to get back to you within 24 hours. That's our goal. We don't always meet it, but we do try to get back to you in a relative amount of time. And of course, visit us at g2aging.org, our website, which we looked at today, to find out any more about the Gateway or about the International Family of Health and Retirement Studies. So that concludes our webinar for today. It looks like we have one question. If there are more questions, please feel free to stay and ask more questions in the question box, and I'll stay here as long as people have questions. And again, I'll mention that the slides will be available sometime tomorrow on the Gateway from today's presentation, as well as will the video. Thank you for attending. Also, I think when you log off, there's a brief survey that just lets us know if this webinar was like about the right time length, if there's something that we didn't cover. So if you were able to fill it out, that'd be much appreciated. But regardless, thank you everyone for joining. I hope everyone is staying safe in these times, and I will be answering questions now. So the first question is, why don't you link the website with LinkedIn and ResearchGate? I don't think I know what it means to link it with LinkedIn, um, but if you would like to clarify that, that would be helpful. I think for ResearchGate, a lot of the researchers who work on the gateway have their own profiles. It's an interesting idea to see if there's maybe a gateway. We could make a gateway profile on ResearchGate. I haven't thought much about that, but thank you for that idea. Um, Julie asked, when do you plan on harmonizing biomarkers? So that's one of the things that we have been building in. It's not available currently in all harmonized data sets. I think that it is available as part of the harmonized HRS currently. The um, the harmonized CLOSA, the Korean data set, I think it's coming quite soon for the harmonized ELSA, the English data set. And I can't remember off the top of my head about the harmonized share. So it is in the process. I would say they would all be available probably within the next year and a half would be our goal to have it available for all the studies. That's one of the things we're kind of rolling out at the moment that we've been working on for the past year. Julie, if you have a question about a particular study which you're not seeing it, just send me or the help desk an email. Maybe I can provide some more information about whether that's been done, so you're not waiting around, or what the timeline would be until it's available. Giovanna, I hope I pronounced that right, said just one clarification. For the harmonized, are the harmonized data sets directly available from your website? In general, no, they're not available from our website. So what happens for most studies is that we work with the study teams to develop a harmonized data set. We program it either in-house or with their programmers in collaboration, and then we give it back to them to release. So because each one of these studies is kind of owned by their own country, and usually it's funded through their government usually cares about who uses the data and how they use it and keeping track of that. So for that reason, most of the studies, you have to go to download the original survey data or the harmonized data set itself. You can always, if you have the original survey data already, you can always create the harmonized data set using that data creation code that we provide. But it's certainly much easier to just download the data set itself. And we have links to how to do that on that downloads page I showed. All right, let's see. Does the gateway, this is from Surana, does the gateway also entertain questions related to data analysis using harmonized data sets? Sure, we're happy to give you some general guidance. We don't run any analysis for anyone. So if you said, hey, can you let me know the prevalence of X in X country in X year, we don't do that. But if you have questions saying like, what weight do I use, or is there a good measure of this that's comparable across these different countries, we're happy to help answer that as best we can anyway. And we'll tell you if it's kind of outside of maybe the research expertise of the team that we have together. But you're happy to email and ask. Yeah. Xiang Ying asks, how is it different between the original study and the same study contributed data to global aging data in terms of level and updates? Let's see, let me try to understand the question. So as far as updated, maybe that's more clear for me. Feel free to clarify if I'm not understanding your question correctly. So as far as updates, so you're right, the study data is updated in at least two ways. One way being that there's new data available. And then secondly, sometimes the studies go back and revise their old data. So they might say, oh, we looked at this and actually we think this person got mixed up with someone else, mixed up their ID. We need to change that. And so that would be changed. Um, so in the case of the data itself, for the harmonized data sets, we always use the most updated version of the currently available study data. So we would always, as soon as they update it, of course, there's a small lag. Like, for instance, if the HRS updates their data set, it might take us, depending on what we have going on as a team, a month to 2 months to get an updated, to regenerate the harmonized data set with the updated version of that data. And then you mentioned level. And I'm guessing that when you mean level, you mean kind of like level of sensitivity or publicly available data. So the harmonized data sets are almost always based on the publicly available level of data. For almost all of the studies, there's some data which is restricted. For instance, of course, the study themselves, they know your name and your address and your phone number, and that information, and even your date of birth, that information usually isn't made publicly available because it's identifiable, and they have a responsibility not to produce identifiable data. Both I think probably legally and to the people who volunteer to be part of these studies. So we use whatever version of the data set is available publicly, and that's different for different studies. On that study overview page on the data access panel there, we have information about if there's different levels of data available. The one thing that I'll maybe mention in terms of levels is the one thing where that isn't exactly true is that, for instance, Tilda, the Irish study, restricts partly because their sample size is quite large to their population. They restrict a lot of in some Irish legislation, they restrict a lot of the information that's available to make sure that it's not identifiable. But what we've been able to do is we've been able to work with their team, and although it might become identifiable, for instance, to give a value of the house, what we've done with their team is we've made a total wealth value based on those individual component values, which would have been identifiable, but the total aggregate wealth value isn't identifiable in the measures that they have to use inside of their institutional and country legislation framework. So there are some times when actually the harmonized data is able to provide, working with that study team, we're able to provide a little bit more information than you were able to get from the public available data of the study data. I hope that answered your question, Jayin. Preeti asks, I'm wondering if hands-on online workshops using RAND-HRS can be organized provided there is enough interest among users. It's a good question. We don't create the RAND-HRS ourselves. There's a whole team of people at the RAND Corporation who create that. And I would say if you're interested in knowing more about the RAND-HRS in particular, the RAND Corporation holds a summer institute where really 2 days are focused on the HRS family of studies internationally. It's called RSI, the RAND Summer Institute. And that's a great place to go find out more information about those. I will say that our kind of hands-on online workshops are advanced webinars using the harmonized data sets. My guess is there's almost no difference between that and using the RAND-HRS. I mean, we really model what we do after the RAND-HRS. So for instance, if we do some kind of hands-on analysis using the harmonized ELSA, that English data, my guess is that would kind of work exactly the same way that you would do that analysis for the RAND-HRS. If we also use the RAND-HRS quite a bit ourselves, so if you have questions about the RAND-HRS, you could certainly email our help desk about those. The RAND-HRS also has their own help desk that you could ask them about if you had questions that are particular to the RAND-HRS, and they would certainly be more qualified to answer those questions than our team would. Harold says, I have learned that there is mortality data in CLOSA through CLOSA's Harmonization Codebook in the Gateway website. However, I can't find variable for cause of death, so I'm assuming there isn't a cause of death, but I'm concerned that I may have missed it. Is it possible that CLOSA assessed cause of death outside of harmonization? For this, should I contact CLOSA? That cause of death variable comes from the end of life survey that's part of CLOSA. So that's that survey with the next of kin or a caregiver after the respondent has passed away. And we are in the process of building the harmonized CLOSA end of life. I will say, like in our current framework, that's a little bit, that's probably, my guess is, happening sometime in 2020. That would become publicly available. We'd be able to release that. So it's a little far away. If you just wanted that variable, though, I would encourage you to you can download the end of life data from the CLOSA website. We have links on our downloads page to be able to do that. And you could just find that one variable, and you could kind of build a comparable version for cause of death to the other studies on your own. If you don't have the time frame to wait until we're able to release the full version of the harmonized CLOSA end of life data set. I hope that helped. Let's see, I think that I have gone through all of the current questions. Are there any more? I'm happy to continue to answer your questions. Let's see, Harold followed up. Also, CLOSA's harmonization process involves including Stata imputation zip file. It seems as though the harmonization process involves imputation techniques, but is that the case? In other words, if I run the Stata code, should I expect to end up with a file with no missing values? I asked because I was planning on imputing a mutation by myself, but it seems as though I wouldn't have to. Yes, for a lot of the studies, they do provide imputed data themselves. CLOSA also does this. So CLOSA provides imputed values already. Generally, the imputed values it's not for every variable. So there still could be some missingness, which you might have to address on your own. But particularly for economic variables, they have been imputed by the study. In a few cases, like in the case of JSTAR, they don't provide imputations, and so we provide them. But almost all of the studies, as part of this kind of commitment to enhanced economic data, do impute the economic data. And in the case of CLOSA, that is also true. So if there's some other variables that you want every case, if it's a complete case analysis and you want to make sure that you include every single respondent, then you might have to impute some variables, maybe something around health or something would have some missing values. You could see the amount of missingness by variable using the harmonized CLOSA codebook. Thank you also for everyone who has enjoyed the webinar. Yeah, I appreciate you taking your time to learn more about this resource and this family of studies. Let's see. And then Harold asks, HRS and ELSA has polygenic risk score computed. In JSTAR or CLOSA, is polygenic risk score data available, I'm assuming? No. I think that HRS and the ELSA are the only studies that currently have polygenic risk scores made. They're also the only two studies that have genetic, I think this is true, I'm pretty sure this is true, that have genetic sequencing data that's currently available for researchers to use to make those polygenic risk scores. So other studies have collected their samples to do genetic analysis or have are in the process it kind of takes quite a bit of process to prepare that data. So they could be in the process of preparing that data and it's not publicly released, but only the HRS and the ELSA have that genetic data available and polygenic risk scores already computed for their samples. Happy I was able to provide some clarification on that. Any other questions, or if I missed your question, just you're welcome to say look up or something. But I think that I have answered all of these. All right, well, if there's not any further clarifications or questions, I think we can wrap this up. Again, thank you for joining. If you think of a question later, just feel free to email our help desk. Also, I think maybe Harold has one more question. Keep typing if you do have it. Yeah, so and if you do have a question after we've left, just email that help desk and we can certainly get back to you, or you could review the slides from the webinar if it was a question about the webinar. Let's see, Harold asks, is it recommended, this is for a specific project, I think related to one that he's doing, which is fine. It might not apply to everyone. Is it recommended to use the RAND imputed cognitive function data, or would you recommend us to use the HRS raw data? I think, so I have done, I mean, just personally, I've done some research around cognition. I would say not a lot. I think one of the things that people really worry about is missingness with cognitive data, because you're going to have a lot more missingness from people who have dementia or low cognitive capabilities. So it's really biased inside of cognitive data who has missings. So from the people who I've worked with who know much more about cognition, like cognition researchers, I do think it is quite important to use the imputed cognitive data if possible. And as you mentioned, RAND has done that as part of the RAND HRS, and they have a great team. They do really complicated, much more complicated actually than we do, imputation processes. So I think it's probably a really high level quality imputed cognitive data available as part of the RAND HRS, and I would suggest to use that. Okay, all right, I'm glad I was able to answer that. All right, thank you all for joining again. I hope you have a wonderful rest of the day and week.